Ready? Okay. Good morning, everyone.
Good morning.
First, I want to thank Commissioner Lowry for his leadership on this issue and for bringing this important initiative forward. I also want to commend our commissioners, leaders from Cook County Health, and community members who've joined us. So let's see, I'll go this way. Commissioner Britton, Commissioner Degnan, Commissioner Miller, Commissioner Stamps, Commissioner Anaya, Commissioner Aguilar, Dr. Eric Makaitis, Chairman Daly, Commissioner Gordon, Commissioner Kevin Morrison, Commissioner Michael Scott, Commissioner Bill Lowry, I mentioned earlier, and, remind me? Martha Helly Cruda. Thank you very much, all of you, for being here. We're grateful. The resolution in support of the Cook County Birthday Health Screening Program is a key step in addressing health disparities. It promotes preventive care throughout all of our communities. Early detection saves lives. By offering free mammograms and prostate screenings, we are removing barriers to care. This is especially important in areas where healthcare access has been limited, and the data is pretty clear. There's a life expectancy gap in our county that's pretty alarming. As you'll hear many times over today, some residents face up to a 30-year difference in life expectancy based on where they live. And usually what we quote is the city of Chicago, where residents in Englewood have a 60-year life expectancy, so that's mid-south side. And residents in Streeterville, which is to the north of here, have a 90-year life expectancy. Same city, 5 miles or so apart. This program is one of many that we need to take to close that gap. We want everyone to have access to quality health care, no matter what their zip code. This resolution is more than just a service. It's about helping our residents prioritize their own health and well-being. And I'm proud to support this program, and I look forward to working with Commissioner Lowry, Cook County Health, and our partners in the healthcare community to make it a reality. Thank you very much, and I'd like to welcome Commissioner Lowry.
Thank you. Thank you, Madam. So, Madam President, thank you, and I also want to thank each of you for being here. I am Bill Lowry. I'm Cook County Commissioner of the 3rd District. Today, I'm very proud to bring my Cook County Birthday Health Screening Program resolution to the Cook County Board of Commissioners for approval. Thank you to President Preckwinkle and my colleagues on the board who have co-sponsored the resolution. As many of you know, I am a cancer survivor. However, for me to learn of my diagnosis, I had to pay out of pocket thousands of dollars. This experience is why today I am proud to present my Birthday Health Screening Program resolution. This resolution will provide patients, whether insured or uninsured, the opportunity to receive a mammogram or a prostate cancer screening through Cook County Health at no cost to the patient. The screenings will be scheduled during the birthday month of any Cook County resident at any Cook County hospital or clinic. I've termed it the birthday resolution because as I speak to those in the community, I say if at no other time, gift yourself around your birthday with a physical exam. In recognition that second to skin cancer, breast cancer is the most common cancer for women, and prostate cancer is the most common cancer for men, this initiative breathes life into the definition of preventative care services. The specific components of the program will be determined by Cook County Health, consistent with federal and state laws which specify the guidelines for breast and prostate cancer screenings. The age qualification for mammograms will be 45 years. For prostate screening, 55 years. Now, while I strive to eventually expand the scope of the health screening program, this resolution is written today. It will promote preventative health care throughout Cook County. It will promote wellness and overall good health. It will promote early detection of underlying health conditions. And this resolution will promote increased life expectancy for all Cook County residents, especially Cook County residents who reside in communities which have experienced disinvestment and limited access to health care for decades and decades. The program will also assist those who are interested in locating a primary care physician or those who desire a health plan which provides Medicaid-covered services. The program will launch in January of 2025 And let me say to Cook County Health, let me say to Otis Story, formerly of Cook County Health, let me say to the President's Office, let me say to each of my treasured colleagues, and to my government team, thank you for your partnership in crafting the Cook County Birthday Health Screening Program Resolution. It is now my pleasure to bring up my colleague and dear friend, Commissioner Alma Anaya.
Thank you so much, Commissioner Lowry. My name is Alma Anaya. I represent the 7th District in Cook County. I'm also the Vice Chair of the Health and Hospitals Committee. It is with great honor that when this resolution was brought forward that, I added myself also as a co-sponsor, particularly because of the people that I serve. The Southwest Side communities like Little Village, Pilsen, Back of the Yards, McKinley Park. I have the largest population of Latinos and immigrants in the whole county. I also have a pretty big concentration of people who are uninsured and underinsured. And oftentimes, in all forms of the health, we hear from our constituents when we do events in the community that the first time that they've learned they had an underlying condition was when it was too late. Or when someone was diagnosed with diabetes is when they were being told that they were going to lose their eyesight or their limb. Sometimes learning that they are, a 4th-stage cancer. So this is very personal. I, unfortunately have had a lot of family members. My grandfather with prostate cancer, and my godmother with breast cancer. So unfortunately, losing family members is not something new for many of us in communities of color that do not have the resources to really get early detection. So this program is extremely important, and the fact that we're trying to be proactive so that people don't come just to our emergency rooms when it's too late, but that we're getting ahead of it, and that we're ensuring that our communities are being taken care of at least once a year. But I'm pretty sure that as commissioners and with the independent board, that we're going to continue to do that and ensure that everybody is covered and that people even under 45 can get tested for breast cancer, to ensure again that folks have all of the necessary information and assessments done really early on. So thank you again to Commissioner Lowry and of course the President's Office and the team in Cook County Health for taking this initiative. Hola, buenos días. Me llamo Alma Anaya. Soy comisionada del 7º Distrito del Condado de Cook. Yo también soy la vicepresidenta del Comité de Salud y Hospitales aquí en el condado. Yo represento comunidades en el suroeste de Chicago, comunidades como La Villita, Pilsen y otras comunidades que desafortunadamente no tienen aseguranza o no tienen la aseguranza adecuada para tener estos exámenes que son tan importantes para la detección temprana de cosas como cáncer de seno y cáncer de próstata. Esta iniciativa es muy importante porque nos da la oportunidad de que las personas tengan una detección temprana, porque desafortunadamente muchas veces cuando alguien se da cuenta que tiene una enfermedad, ya es demasiado tarde. Y es nuestro deber como condado, es nuestro deber teniendo un sistema de salud que tomemos esto en cuenta y que hagamos todo en nuestro poder para salvar vidas y para que estas personas tengan la información adecuada, temprana, para poder tener tratamiento. So, muchísimas gracias a todo el equipo aquí en el condado que ha hecho esto posible. Thank you. Oh. And I'd like to introduce Dr. Mikaitis.
Okay, thank you, Commissioner Anaya. Good morning, everyone.
Good morning.
Good morning.
I'm Dr. Eric Mikaitis, Interim CEO of Cook County Health and an internal medicine physician. I would like to express my gratitude to President Preckwinkle for her leadership and support of our health system, and to Commissioner Lowry for his vision and advocacy on the birthday screening initiative. It can be hard for people to track on their annual wellness health checkups. Scheduling a physical or preventative screening around your birthday makes it easier to remember and prioritize these important visits. Having this routine can help ensure consistency and reduce the chance of skipping or forgetting an appointment. Preventative screenings, including prostate exams and mammograms, are particularly important for African American and Hispanic patients who are at greater risk of developing cancer at a younger age and having more aggressive, difficult to treat cancers. We also know that patients who do not have insurance are too often shut out of our nation's health system and have limited access to care, which has deadly consequences. Uninsured women are more than 2.5 times more likely to be diagnosed with late-stage breast cancer and are 60% more likely to die due to breast cancer than insured women. We see similar inequities among men, with uninsured men being approximately 2 times more likely to die due to prostate cancer than men who have private insurance. Regular screenings are essential to early detection and treatment of these cancers. Studies show that in women aged 40 to 74, mammograms can reduce breast cancer deaths by 40%. In men, prostate cancer screenings can reduce mortality rates by up to 25%. It's clear that screenings are an essential component to eliminating disparities in healthcare access and outcomes. At Cook County Health, we have a historic mission to care for all, regardless of ability to pay. Cost should not be a barrier to these important health screenings. We're proud to partner with President Preckwinkle and Commissioner Lowry to ensure that all residents, particularly those who are uninsured, can get access to screenings free of charge during their birth month. Scheduling important annual screenings near your birthday is an easy way to prioritize your health and stay up to date with your care so you can celebrate many more birthdays to come. Thank you. And you got it? Okay.
Dr. Makaitis, thank you. It's now my pleasure to ask one of my law partners and a very dear friend, Martha Haley Crudo, to share some words. Martha.
Thank you, Commissioner Lowry. It's an honor to be here today. My name is Martha Haley Crudo. I am a breast cancer survivor. I am also a Portrait of Hope ambassador for the American Cancer Society and making strides for against breast cancer Chicago. I can unequivocally tell you that early detection saves lives. It saved mine. I was diagnosed with breast cancer in 2022 through a routine mammogram. I had no family history of breast cancer, and I had no symptoms whatsoever. This is why regular breast cancer screenings are so incredibly important. When cancer is found early, it is easier to treat successfully. I am proof of that. Without that routine screening, I don't know if I would be standing before you today. However, that early diagnosis would not have been possible without the privilege of healthcare, and it is a privilege to have healthcare. This is why the Birthday Health Screening Program resolution, sponsored by Commissioner Bill Lowry, is crucial in providing all Cook County residents with the opportunity to take care of their health in a proactive manner, instead of being diagnosed with cancer when it might be too late. The earlier we are diagnosed, the more likely it is that we can be healed. Excuse me. The Birthday Health Screening Program resolution is a monumental step, not only in the fight against breast and prostate cancer, but also in closing the gap between those who can afford health care and those who cannot, promoting wellness and overall good health among our residents will have a profound effect on families, on our neighborhoods, our economy, and our city as a whole. I can't think of a more meaningful birthday present than the gift of health and access to preventive health care. As a cancer survivor, as a wife, as a friend, as a mother, I say thank you to President Preckwinkle, the Board of Cook County Commissioners, but especially to my dear friend, Commissioner Bill Lowry, for his support and tireless advocacy, not only to the residents of the 3rd District, but to all Cook County residents. Thank you, Bill.
Come here. So now I will ask my colleagues to share some words, and I'm going to ask you to limit your comments to 2 minutes. And I'm going to say that again, 2 minutes. So we'll start with Chairman John Daly.
Thank you, Bill. Madam President, Doctor, and my fellow commissioners. This is a great resolution to give yourself a birthday screening. Right now, we're very lucky. Cook County Health provides good quality health care for anyone who comes in within their doors, and as long as I've been on this board, I'm proud to support it and continue to support it under leadership of the president. I had a scare this past year. I had a colonoscopy, thought it was routine. They told me at age 77, you don't need it. I said, well, I'll do it again, and I was very lucky. They found something. It was removed, no cancer, and but I thought of when I was laying in that bed, all the other people who don't have that opportunity. This is a beginning. With prostate and breast mammograms. I lost a sister-in-law at the age of 44, hit her out, and Maggie Daly at age 67. But Barbara Daly was a very young age, so the earlier detection on everything. Urge people, Bill, congratulations. And this is a great beginning for, hopefully we expand it to others. But I really want to thank Dr. Makaitis and the quality health care under his leadership at Cook County Health. Thank you very much.
Commissioner Scott Britton.
Thank you, Bill. I'm Scott Britton, the Cook County Commissioner of the 14th District. You know, a number of us up here, if you've already heard, belong to a club that nobody wants to be a part of, which is that we've survived cancer and cancer treatment. I have as well with chemotherapy and radiation. And I can tell you that one reason I'm standing here is because I had the best care you can possibly imagine. But as I've said many times, that's substantially in part because of my zip code. And that the fact that everyone in this county does not have the same access to care that I did is unconscionable. And it is the purpose behind this board's continued commitment to Cook County Health and expanding the opportunities for those who are typically not receiving care to receive it now. I can tell you that the cancer that I had would not be detected by these two tests, and I am promising to my very good friend and brother, Bill Lowry, that this is our pilot, but we commit to try and further expand this to other cancers so that no one ends up having to find out that they were diagnosed too late and end up in a situation where they might not be able to survive. This is our commitment. This is our commitment to Cook County. I thank, of course, the President and Bill for all of this good work. Thank you.
Commissioner Bridget Degnan.
Good morning, everybody. My name is Bridget Degnan. I am the Cook County Commissioner in the 12th District. I first want to thank our Board President, Tony Preckwinkle, Bill Lowry, and the Cook County Health System for supporting this resolution. When they say you have nothing without your health, that is something we only think about when we're sick. And I know that you guys prioritize your family life, your work, doing household chores, and so many other things before you prioritize your health and yourself. So this resolution gives you that opportunity, gives all of us that opportunity to prioritize ourselves. Well, I cannot take a part and benefit from the prostate screening. There is something in this resolution for everybody. And so I'm very proud to sit with my board and with the leadership of the county to support everybody in this county who needs health care, everybody in this county who can take advantage of this and come to Cook County Health and make that your hospital home. So thank you.
Commissioner Donna Miller.
Good morning, everyone. I'm Commissioner Donna Miller, and I do want to thank my brother here, Bill Lowry, for sharing his very personal story with all of us, as well as Cook County Hospital System and President Preckwinkle for making this possible. Birthdays are definitely a time of celebration, and we do want to make sure that we keep celebrating birthdays. So this is a way to ensure that not only the most important factor that happens when we talk about screenings is the education piece of this. People can't know what they are not taught. So we need to teach our patients about the importance of getting the screenings so that no one can say, I wish I would have known. This will help them focus on that, and their birthday is a great day to be reminded of that. And one of the things that also, cancer has touched all of us. My sister just recently had a double mastectomy for breast cancer, and it was because she did not get her screening for over 3 years that when she finally did go in, luckily it was stage 1 and it was caught early. So early detection matters, and I keep saying that when people don't know that they should continue to go in, even if they think they're fine, This is nothing you can think you're fine about. As we heard, no one knows that they have had cancer diagnosis until they go in, and then screening is what's going to help them get that information. Also, as I represent the south suburbs, we don't want different areas having different levels of health care, which is something I've been advocating for since my entire time on this board. Where you live should not determine the outcomes of your health care or the outcomes of your life. So education is key, prevention is key, and we have all the tools in our toolbox to make both of those things happen. So this resolution helps us focus on that. Thank you for having me today.
Commissioner Tara Stamps.
Good morning. I'm so honored to be on a board at this time with such compassionate, empathetic people who are always thinking, while dealing with their own crisis, how can they use this position to help others? That is so critical. And as was stated before, cancer touches all of our lives. My father passed away due to prostate cancer. And so thank you, Bill, for using your testimony to help the lives of others. And I know that because of the composition of this amazing board, that this is only the first step in what we're prepared to do to help it not only just eradicate it, but definitely make sure that everyone in the county has access to the proper screenings and the proper care to just be able to live their best life. Thank you.
Commissioner Frank Aguilar.
Thank you, Commissioner. Happy birthday. Madam President, Commissioner Lowry, this is the best and most wonderful, like you said, the best birthday gift you give the people of Cook County, the gift of life. You know, the laws that govern life and death transcends the law of mankind, and life and death doesn't care if you're insured. And if we have the power to save people's life, we have a duty towards humanity, and this is exactly what this resolution does. So thank you, Commissioner. Thank you, Madam President, for your leadership, and thank you to my colleagues.
Commissioner Monica Gordon.
Good morning, everyone.
Good morning.
I want to thank Commissioner Bill Lowry. I want to also thank the President's Office, Madam President Tony Preckwinkle, Dr. Makaitis, Cook County Health, and also Vice Chair Alma Anaya for bringing forth this incredible resolution. Early detection is key. Early detection is everything. It allows for prevention. So over 20 years ago, about a week after I graduated from undergrad, I lost my best friend, biggest supporter, my granddad, to prostate cancer. And also my mom, who has recently battled breast cancer. She just finished her chemotherapy and radiation. But guess what? She has her annual mammogram every year. And during one mammogram, they found that she was stage 3B, and she has it every year. So that's why I always promote early detection. And my predecessor, Commissioner Deborah Sims, she was a pioneer in bringing breast cancer testing and mammogram testing to the community, bringing it actually to them. If they can't get to the hospital, she will bring it to them. And we've been, Rosen Hospital is one who has a mobile van that gives mammogram testing. And recently, some of the stakeholders in the Southland hosted a health fair, the first Southland Health Fair, where we had the mammogram van on site. And I know some people here, I know Commissioner Miller visited that van as well. So I'm just very ecstatic about this. I think it's a great step in the right direction because, as I mentioned before, early detection saves lives. And these are breast cancer and prostate cancer. There are definitely two cancers that are very prevalent in the African American and Hispanic communities. And hopefully this is the step where we can prevent death and save many lives. So I thank you again, Commissioner. Thank you.
Commissioner Kevin Morrison.
Thank you. Good morning, everyone.
Good morning.
I'm Cook County Commissioner Kevin Morrison. I represent the 15th district in the northwest suburbs of Cook County. First, I want to thank President Preckwinkle for being supportive of all of our commissioners and helping us do this work. I want to thank Commissioner Lowry for inviting me to speak, and I commend him for his incredible work and advocacy. Annual birthday health screenings for prostate cancer and breast cancer will go a long way in saving lives. Cancer is something that affects everyone. There are few who can claim they do not have a loved one who has not been affected by cancer. 3 years ago, I lost a friend, Melissa Hanasek, to late-stage diagnosed cancer. This past Tuesday, I learned that a woman I've known for 30 years was just diagnosed with stage 4 cancer that had metastasized and has already spread across her body. I know too many parents out there who prioritize their children over themselves. And so I want to give a reminder right now to every parent out there that going and getting your annual checkups and screenings is prioritizing your children because it will keep you here longer. That is precisely why increasing advocacy and access to health screenings is critically important. Access to screenings is crucial in order to catch these diseases early. The earlier they are caught, the more likely the treatment will be successful. Thanks to Commissioner Lowry and the work of our team at Cook County Health, everyone in Cook County will have access to prostate cancer screenings and mammograms, regardless of their background or financial situation. I'm incredibly proud of his work, informed by his experience as a cancer survivor on this issue. It is thanks to his efforts that thousands will receive the help they need and so many more lives will be saved. I encourage all residents to take up these annual screenings. That is exactly why I, along with my colleagues, led the effort to get rid of the sick note requirements at the county, as well as allow for mental health days so that people could use that time to get their regular checkups and to protect their own mental health. I look forward to working alongside my colleague, Commissioner Lowry, Cook County Health, and my other colleagues on the board as we put this resolution into action and ensure it gets implemented successfully for all. Thank you.
Commissioner Anthony Casada.
Good morning, everyone. My name is Anthony Joel Casada. I'm the Cook County Commissioner of the 8th District, and this is yet another example, shining example of Cook County government at its best. You know, I think that this resolution, and I want to thank Commissioner Bill Lowry, Madam President, and Dr. Makaitis for bringing this forward. And I listened to your story on, I think, was it Fox News that you told your story with cancer? And I was deeply moved by it. And I really appreciate you being so public and forthright with this story because this is about educating people around their health. And to know that we are in line with our principles of providing health care as a human right, providing this as a free service from Cook County Health is amazing. There are so many people, low-income folks in our communities who struggle and worry about their health, but also worry about the debt that they're going to incur if they pursue having good health. So providing this resource is extremely beneficial for our community, especially as also in the Latino community, which I represent large portions of in the 8th District, because prostate cancer is the highest diagnosis of cancer, type of cancer for Latino men. And as a young person, I think it's also really easy for young people to think that they're invincible and that nothing's ever going to affect them. So I really look forward to working and collaborating with Commissioner Lowry and our whole Cook County team to provide this education for young people as well, to say you should be looking at this as a part of your health routine and your health hygiene as you get older. So thank you very much, and I look forward to further collaboration with this entire team. Thank you.
And Commissioner Michael Scott.
Good morning. Thank you. Thank you. Good morning, everybody. Good morning. I am Michael Scott Jr. I'm Commissioner of the 2nd District. And I want to thank Bill Lowry, the President's Office, and Cook County Health Systems for this really, I think, important resolution. My predecessor was really big into health and health disparities across the county. And so, God rest his soul, I am very happy to be able to support in his stead. My mother, when I was probably just out of college, was diagnosed with cancer. She had gone through her screenings kind of regularly, but not annually. And we got to the hospital. She was in good health. We actually thought she had pneumonia. And when the doctor took, her vitals, kind of realized that she had cancer, and it had spread throughout her body. And it was because she had not gone regularly. Now, she had gone for her checkups, but she had not gone regularly. And so, my sincere belief is if she had done this on a regular basis, we would be here to celebrate her birthday. That is unfortunate. Because of this resolution, there will be so many people across this country, across this county, that will be able to celebrate their families, their mothers, their children's birthday. And so I am just proud to be a part of a body that acknowledges the health disparities that the president talked about. I serve many of those communities on the west and south side where that disparity are those 30 years. And so I am just very happy and proud to be a part of this body, to champion this resolution. And I want to commit to you, because I think education is really important as well. We can have this, but we have to make sure that our county residents know about this. And so I want to, alongside of you, champion and educate people so that they understand that they have this free service at Cook County. Again, thank all of the commissioners, thank this body, and thank you, Madam President, and thank you, Bill.
Thank you, Commissioner. And yes, our treasured friend and my brother, Commissioner Dennis Deere, is smiling down on us today. We're going to hear lastly from another treasured colleague, Commissioner Maggie Trevor. Just say hello.
Hi, I'm Cook County Commissioner Maggie Trevor of the 9th District. Sorry I'm late, stuck in traffic. I wanted to make sure I got here to support my colleagues on this. This is so important. This will save lives in Cook County. This will also reduce medical expenses in Cook County. But most importantly, it helps people connect to their health on a regular basis. And I want to thank my colleague for this. Bye.
Doctor, you want to?
Hello again. So to answer the second part first, this is for everybody, and very much beyond just the cost piece for our county residents. The focus here is about education and prevention, right? Getting upstream and providing those screening exams so that we aren't getting to a point where people are coming in needing hospitalization, advanced interventions. So it's for all Cook County, and it's really about, it's about making sure that our patients understand and are aware that this needs to happen in terms of prevention. Mm-hmm. So even if you have insurance? Yes, yeah, it's for everybody. Mm-hmm. Yeah, with Cook County Health, yeah. And how do people go about signing up, registering? Yeah, so visit our website, cookcountyhealth.org, and they can find primary care and reach out through there to schedule an appointment. Mm-hmm. Yeah.
Obviously, this is very beneficial for everybody, but can you specifically, from a medical standpoint, say why these screenings are even more vital for perhaps the Latino and the African American community?
Yeah, so as I mentioned in my comments, access to healthcare, especially in the uninsured, is an issue, and having that awareness and that education, especially in those communities, will help, I believe, to start addressing those disparities in terms of life expectancy.